Thank you, sir, for your time here on ENCA. Now, we know the plight of the nurse, especially after salary increases were frozen by government and now not receiving that allowance for uniform. What are your members telling you about the stresses they have financially?
Good morning, Martha, and viewers at home. And nurses are very disappointed and angry to the attitude that our government is portraying towards them. First, it was an attack during COVID-19 where government refused to come up with an allowance of that nature as a disaster management act with some funds. But they refused to give danger allowance to nurses who were exposed to COVID. Subsequent to that, there is a standing resolution of 2005 that says the employer is obligated to give workers the uniform allowance in April. But over the years, this government has decided to ignore this plight and think that workers will continue to tolerate this ill treatment from the government. So this year, DENOSA KZN Executive Council decided that moving forward, our members are not going to be wearing this uniform until the employer pays the uniform, because it is not a favor, but it is an obligation from the employer who is continuously undermining nurses in this country. So as DENOSA KwaZulu-Natal, we want to warn those managers who are trying to be populist, intimidating our members as if this money must come from them. We want to request politely from them, if they feel they have this uniform allowance to pay to our members, they must indicate so that our members will channel their frustration to them and demand this uniform allowance from their own pockets. Because this money is from the Department of Health in the province of KwaZulu-Natal, who must pay our members. But we are seeing certain managers deciding to be the populist, acting like they are the best managers than others, intimidating our members as if this money is from the institutional payment. But we don't have a problem. If they feel strong that these nurses must be intimidated, we're going to channel our approach to them now. And we'll leave the Department of Health, because it seems they have many money in their coffers that they want to give to our members.
Now, Mr. Shabangu, have they explained to you at all, the Department of Health in the province, why that money didn't kick in on the 1st of April?
You know, this matters I'm saying to Matseho is dating back 2005 as an agreement. Over the years, we get the same excuse that as the department, we've done what we have to do. There's a delay with the system in paying people pragmatically, which is a process where they just pay people once. We cannot continue to tolerate that stupid excuse, because it is a merely excuse of incapacitation in the department or office of HR, because they are failing to do their work. And we feel that they are doing this thing purposely, because it only pays nurses, not any other employees in the department. And we feel that the department is continuously isolating nurses, in ill-treating them, and then the department wants to pretend like they are the victims in the whole thing.
Have your members explained to you exactly what it is that these managers allegedly do to make them feel intimidated?
They have not only explained, they gave us an email from one manager from King Edward Hospital who was intimidating our members that if they don't come on uniform, she's going to send them home and they'll get leave without pay for that day, which we think is just very unprecedented, that a manager will chase you from work and then claim that you did not come to work and you must get leave without pay. Similar attitudes are coming from hospitals like your CTK, your Eddington, your Nkonjeni, where these managers want to act like they are better than the Department of Health in the province. They make decisions on behalf of the department. We cannot allow this to continue, because these institutions, they want to behave like they are federal institutions within the department. We are communicating with the department provincial office, who are the principals of this department, not managers in facilities. So we want to caution those managers that they must withdraw those emails they've been sending to our members for operational managers to intimidate our members and chase them away. To a point that certain members were told not to touch the patient. They must do any other task in the ward, like cleaning, which does not encompass the duties of a nurse. But because these managers want to throw their weight that they are managers, they are intimidating our members to that level.
Now, if they're telling nurses not to touch patients, they're now putting the lives of the patients at risk.
That is what we are worried about, that it looks like these managers, they don't care about the patient, but what they all care about is to try to throw their power to our members. Our members are rendering themselves to continuously service our public under circumstances. Now they are being ill-treated because they are not wearing a uniform. What is key to us is that we told our members that even if they are not happy with this government, but they must go and service our community, they must go to work and nurse those patients, which does not need a nurse to wear a uniform. Nurses are nursing the patients, but on top of that, they get managers who wants to be better managers by intimidating them. We are saying this thing must stop, because if they continue with this attitude, we're going to ask our member not to report for duty then until they get their money. And these managers will have to see fit how they deal with the patients, because nurses are offering themselves. But on top of that, they are further victimized by these managers.
Let's talk about until this money reflects. Have you been told at all by government exactly what's going to happen in terms of this money reflecting in the nurses' bank accounts? I mean, the 1st of April is more than a month ago.
That is why, Matseho, we are saying we want these managers to hold their excitement, because they are provoking workers. We communicated with the department as early as mid-April to say, we know that the guidance has come out from National to say how much should be paid to our members. Can we get the date? That was in April. They refused to give a date, but they said they are committing that by the 13th of May, this money will be in our members' account. Came 13th of May, no explanation, nothing. The money was not in their account. Now, after we issued a second letter to the department on the 14th to say, having seen that the money did not appear, our members have taken a decision that come the 17th of May, they will not be wearing uniform. And that communication, it was sent to the Chief Director HR in the province, who is responsible for all HR in the province. Now, we find managers who are saying, DENOSA did not tell us. DENOSA don't have to tell you in an institution that this is a decision, because this matter is a provincial matter. It is not an institutional matter. So we then received a communique on Tuesday, the 18th, saying we will pay the money. The run of this money will happen on the 24th, which is this coming Monday. And our members must expect their money on Thursday, the 27th. Because of the previous trust issues, our members have said they are not asking whether the money is going to be in. They want to see their money in their pocket. That is the only time they will stop not wearing this uniform, because they don't have the uniform. So if employer keeps on keeping these promises, it's fine. Workers are willing to come to work, service our communities until they get their money. Then they will go and purchase the new uniform.
Mandla Shabangu of DENOSA KZN, thank you very much for your time.